Hi, I'm Carrie Elizabeth Lynn. I'm a licensed professional counselor and I also have bipolar disorder myself. Today I'll be talking about bipolar II disorder. So, a diagnosis of bipolar II requires at least one depressive episode and at least one hypomanic episode. In addition, there cannot have been any manic episodes in a person's history. It is possible for someone diagnosed with bipolar II to later be re diagnosed with bipolar I. All that would take is one full-blown manic episode. In my video on bipolar I, I described a number of specific differences in what bipolar disorder can look like. Those specifiers also apply to bipolar II, so you can watch that video if you want more information. Just as with bipolar I, there's a lot of variability in bipolar II, and it's important to have an individualized treatment plan. In this video, I'd like to address a common misconception, which is that bipolar II is a milder form of bipolar disorder. The reality is that bipolar I and II are distinct illnesses that both have a serious impact on people's lives. Many people think those with bipolar II are better off because they don't experience mania. It is true that mania can be extremely disabling. I have bipolar I and I've experienced that firsthand. But there are a number of reasons bipolar II cannot be considered a milder or less serious illness, and I'll go over 5 of them. First, generally speaking, people with bipolar II spend more time in depression than people with bipolar I. Their depressive episodes tend to be more frequent and last longer. Even though they don't experience mania, their depressive episodes can be very disabling. Second, people with bipolar II are at greater risk for suicide. Those with type 1 and type 2 attempt suicide at similar rates, but evidence shows the completion rate is higher for people with type 2. In other words, their attempts tend to be more lethal. Third, people with bipolar II are more likely to have a rapid cycling course. As I explained in my video on bipolar I, that's where you have 4 or more episodes of any kind during a year. Also, the lifetime number of both hypomanic and depressive episodes tends to be higher for those with bipolar II, although they generally spend much more time in depression. Fourth, people with bipolar II tend to have less complete inter-episode recovery, meaning more symptoms between episodes. I mentioned in my video on bipolar I that someone who's not currently experiencing an episode is considered to be either in full or partial remission. People with bipolar I tend to have fuller remissions, in other words, more complete recovery between episodes. People with bipolar II tend to have less complete recovery. And then finally, the fact that people with bipolar II don't experience mania may ironically be a disadvantage. On average, people with bipolar II are less likely to seek treatment and stick with their treatment plans. Oftentimes, people with bipolar II don't see hypomania as a problem. In fact, they may think it's a very positive thing that's enjoyable and enhances their creativity. So they may choose not to get treatment because they don't want to lose the hypomania. Full-blown mania, on the other hand, is much harder to see as a positive thing. It can actually be a horrible experience when it includes things like psychotic or mixed features. And even if it feels wonderful, it's likely to involve behavior that's humiliating at best and disastrous at worst. So some people with bipolar I are more likely to seek treatment and stick with their treatment plans, at least in part because they want to prevent mania. They're also more likely to view hypomania as a problem since they know it may lead to mania. So those are the basics of what bipolar II is and how it compares with bipolar I. You can probably see that bipolar II cannot be considered less serious than bipolar I. The key thing to keep in mind is that these are distinct illnesses that affect people in different ways and require different treatment. Thanks for watching, and here's to good mental health.